Hello, I'm Dr. J.C. Clark with ORA Orthopedics here in the Quad Cities. Due to the COVID-19 pandemic, we're seeking other avenues to provide orthopedic care to patients in and around the Quad Cities. One of those ways is via telehealth, wherein we use our computer and the camera on our computer and use your phone and the camera on your phone, or maybe your computer and the camera on your computer to do a physical examination. One of those physical examinations that we can perform is a hand and wrist evaluation, and that's why I'm here today to talk to you about. How exactly can we do a hand and wrist evaluation via a telehealth means? Now, the first thing you want to do to get ready for a telehealth physical examination, especially of the hand and wrist, is to have the appropriate exposure of your hand and wrist. And so this means obviously not wearing gloves or other clothing that could obscure the skin, and having an area where the physician, with your camera, be able to fully see all the movements of your fingers and hand and wrist. This may mean having somebody else help you hold the camera on your phone or the camera on your computer to get a better view of the exact motion that your hand and wrist and fingers are doing. For example, the camera that I am talking into right now is right around 3 feet away from where I'm sitting, which is a good distance away, to be honest, to look at the hand and wrist and fingers. You may need somebody to hold that camera a little bit closer so we get a nice view of each joint of your finger while we do the evaluation. Just keep that in mind. If you don't have anybody else around to hold the camera or get a good close-up, you can maybe use the non-involved hand. For example, if my left hand was the one with the pain, I would use my right hand to hold the camera to look at my hand. There are ways that we can work around doing that. To do a deep dive into the hand and wrist evaluation via telehealth, let's start first with a quick little anatomy lesson, because knowing the anatomy better from your end will actually help the physician as well. So when you look at the hand and wrist, there are 2 bones of the forearm that provide support, or the base, for all the little bones of the hand itself to rest on. So this makes up the wrist joint, the radius, the ulna, and all of the little carpal bones of the hand. Now, extending from those carpal bones, we have metacarpals, and then we have the phalanges. Now, when you look at each finger, so each finger has 3 little bones that make up the finger. The thumb, on the other hand, has 2 bones that make up the thumb. So just keep that in mind. When we do an evaluation of the hand and wrist, even though it's a small area, there are a lot of structures that make up this very important part of our body. Aside from the bones, we have all the tendons and ligaments around the hand. So for example, on the extensor side, or the back side of our hand and wrist, we have all these extensor tendons that run down the length of the fingers all the way to the tip. Flip it over, and on the volar side, or the flexor side, palmar side, we have all these flexor tendons that run to the tip of the finger. Now, there are actually 2 flexor tendons that run to each finger. The flexor digitorum profundus runs all the way to the tip, and the flexor digitorum superficialis runs right to the middle phalanx right here. So there's a way we can evaluate each of those flexor tendons, even via a telehealth means. Not only do we have the flexor tendons and the muscles, but we also have the nerves, such as the median nerve that runs in the carpal tunnel, and the ulnar nerve, which runs on the ulnar side of the wrist. We'll be able to evaluate those too via a telehealth means. So the first thing that we want to do when we do a physical examination through a camera system like this is to observe and inspect the hand. And the reason why we're doing this is we're looking at the skin, making sure there aren't any cuts or lacerations, or maybe even some previous incisions from surgeries that you may have had in the past. We're also looking for any erythema or redness of the skin that could be indicative of infection. We're looking for swelling, bruising, that could also be a sign of a fracture or dislocation that you may have sustained to your hand or wrist. Some of those issues, especially more urgent issues, we may want you to come in and get an x-ray or a further evaluation if we deem that is appropriate via a telehealth examination. The next thing that we'll have you do after we just inspect the skin and the general appearance is we may have you point to exactly where you're hurting. By pointing to a specific area, we can anatomically hone in on that area to do a more detailed exam. For example, if you were to point right to this area, we may focus more of the exam on the thumb and some of the important bones that lie right under the skin in this area, such as the scaphoid. If you were to point more on this side of the wrist, that could be a whole different, detailed, honed-in physical examination looking for basically a cause of ulnar-sided wrist pain. If you point to one of the fingers, then we can do a detailed look at that specific area. So we may have you point specifically to where exactly you're hurting. It would be cool also if you had a marker nearby. You could even draw like a little circle around the most intense, painful area of your hand and wrist. The next thing that we want to do after just observing, inspecting, and having you point to where it hurts is have you do some active motion. And so in clinic, usually I have my patients put both arms up like this, and I'll have them flex the wrists. So that's flexion of the wrist. I'm able to then compare flexion of each wrist to each other and see if there's a difference. Then I would have them extend the wrists, again looking and comparing the motion of both wrists. Then I'll have them tuck their elbows to the side, put their thumbs up, and then rotate out, which is a motion called supination, and then rotate in, which is a motion called pronation. That helps me get an idea of how the bones in the forearm are rotating around each other. It gives me a clue to where maybe there could be a pathology of that joint near the elbow or that joint near the wrist. After focusing on the wrist flexion extension, then we can look at finger flexion and extension. So having you flex your fingers and make a grip, having you extend your fingers out, having you flex your thumb and extend your thumb. We get a good idea of not only the function of the tendons when you flex and extend your fingers, but also the function and the structure of the joints of your fingers when we just have you simply make a grip and extend your fingers out. After observing, after having you point to where it hurts, after looking at your motion, we may hone in on a specific area and do specific tests that we as orthopedists like to do to test ligaments and specifically test areas of the flexor tendons or extensor tendons. So let's just start with the thumb side of your hand and wrist. So on the thumb side, if you were to point to pain in this area, that could be tendonitis of those thumb extensors. We may have you do a special test called Finkelstein's test, where you tuck your thumb into a grip. So you tuck your thumb around or inside the other fingers, and then have you move your wrist down like this. If you have intense pain throughout those extensor tendons of your thumb when you do that Finkelstein's maneuver, that may be a sign of tendonitis of those extensor tendons. Also, right in this area, there's a very common joint that can get arthritis at the base of the thumb. This is called the CMC joint. Oftentimes, you may see some little bone spurs that come off that area of the thumb. A specific test to look for arthritis of that thumb is called the CMC grind test. And essentially, what you would do is just take your thumb, push that joint together and rotate. If that causes exquisite pain and some grinding in that joint, that could be a sign of arthritis at the base of your thumb. Occasionally, we'll catch our thumb on a structure and cause an injury to a ligament on the side right here. This is called skier's thumb or gamekeeper's thumb. And usually we can do a stress test of that ligament in clinic, do a really hands-on evaluation of that ligament. But you can also do it yourself by just taking your opposite thumb, putting it right on the outside of that joint, and then pulling your thumb back. See how it stretches out the skin on that side of the thumb? It will also stretch out that ligament on the inside. If that causes pain, discomfort, or you feel like your joint's about ready to pop out of place, that's a good sign that you could have an injury to that major ligament on the inside of the thumb. Working right around that thumb area, there's a specific spot right here. If you were to extend your thumb out, there's a little divot. That's called the anatomic snuff box. It's actually a place where people used to put tobacco before they put it in their nose or mouth back in the Old West. That's why it's called the anatomic snuff box. So tenderness right over that spot right there could indicate a possible fracture of a very important bone in the wrist called the scaphoid. So we may have you push right in that spot called the anatomic snuff box. All right, let's migrate a little bit to the front, or what we call the palmar side of our wrist and hand. Right here on the front of our wrist and hand runs a very important nerve called the median nerve. Pressure on this nerve can cause carpal tunnel syndrome. A couple tests to see if that is really flared up or a carpal tunnel syndrome is occurring in your wrist is something called the Phelan's test, where you take both of your back sides of your wrists, push them together, and really flex your wrist down to 90 degrees. If you were to hold this for right around 60 seconds or a minute and start to have numbness or tingling into your fingers, that could be a sign of carpal tunnel syndrome. Another simple way to test for that is just to take your thumb and push right over that carpal tunnel. And by pushing over that carpal tunnel and that canal for about 30 seconds, if you start to feel numbness into your thumb and index finger, that's another way we can test via telehealth whether or not you have carpal tunnel syndrome. Moving further ulnarly on this side of the wrist, there are a lot of different structures that can cause pain on the ulnar side of the wrist, or the little finger side of the wrist. There's a little piece of cartilage at the top of the ulna, so this bone right here, called the triangular fibrocartilage complex, TFCC for short. We'll make it easy on ourselves. If that area, if that complex has a tear of it, it can cause pain, especially with gripping or if you move your wrist in this direction. So to stress that area, sometimes we'll have you ulnarly deviate or move your wrist to this direction and then rotate. So you can see if I ulnarly deviate and then rotate my wrist back and forth, what I'm doing effectively is pushing down onto that complex and then rotating or grinding the other bones of the wrist onto that triangular fibrocartilage complex. And if there's a tear, it's going to cause pain when I do that. So we may have you do that. We also may have you just push over that little piece of cartilage, and if you have pain in that area, it could be an indication that you may have an injury to that little cartilage complex or possibly the tendon overlying it. Also running along this inside part of the arm is the ulnar nerve. So that's the funny bone nerve right at the elbow. Sometimes people can get numbness into little finger and ring finger due to compression of that nerve, either here at the hand or at the elbow. We may have you flex your elbow for a prolonged period of time, just as if you were talking on a cell phone, and see if with that elbow flexion test, you start to get numbness into the little finger and ring finger of your hand. There's a small little bone right here on this side of the wrist as well that sometimes can cause pain and discomfort, especially if you get arthritis in that small little bone. This little bone is called the pisiform. And if we have you grab that little bone and move it back and forth or put pressure on that bone, that could be a sign of arthritis in that area. Now, let's move into the palm of the hand. Sometimes people can get little cords or nodules right underneath the skin in the palm of the hand. This is a specific condition called Dupuytren's contracture. It's very common in people of Scandinavian and Irish and Scottish descent. And so if you have those genetics and find that you're getting these tender, palpable cords in the palm of your hand, that could be a sign of Dupuytren's contracture. One way to test that is called the tabletop test. So putting your hand on the table, if you can't push your palm flat like this, then that's a sign that we may need to have you come in and possibly talk about a surgery to release those tight contractures or cords underneath the palmar fascia of your hand. So that's called a tabletop test. So we may have you do that. See if you can put your palm flat. Now moving out towards the fingers, remember I told you that you have two flexor tendons that go to the tips of the fingers here. One, the flexor digitorum profundus, one, the flexor digitorum superficialis. There's actually a way that you can test those two flexor tendons even on your own. So to test the tendon that goes all the way to the tip of the finger, what you can do is keep this joint, the metacarpal phalangeal joint, and this joint, the PIP joint, straight. So if you take your thumb, keep those joints straight, and just try to flex that DIP joint, or the tip of your finger, that isolates or tests the flexor digitorum profundus. So we may have you try to keep those other joints straight and then flex the tip. That tells us that you don't have a condition called jersey finger or a rupture of that flexor digitorum profundus all the way to the tip. The way to test the flexor digitorum superficialis is to put your back of your wrist on the table, hold the other fingers down that you're not testing, and then flex your finger up. So for example, here I'm testing the flexor digitorum superficialis of my index finger. Here I'm testing the flexor digitorum superficialis of my middle finger. And of course the ring finger and the little finger. So if you hold the other fingers flat and try to flex the finger that you're testing, that's a good way of figuring out if your flexor digitorum superficialis is intact. We abbreviate it FDS. So that tests all the flexors going to the tips of your fingers. Now sometimes people can get what's called a trigger finger, and what that is inflammation around one of the pulleys right at the beginning of a tunnel that all of our flexor tendons travel in down the finger. So a trigger finger is where you would flex your fingers and then try to extend them. And it's very tough to extend that trigger finger, and sometimes you have to pull it open. So let me do that again. You extend all the other fingers and then finally be able to snap that trigger finger open. So that's a good sign that maybe you have a trigger finger. People who have trigger finger also have tenderness right at the base of that finger. Now, moving to the extensor side, sometimes you can hit the tip of your finger on a ball or maybe a tabletop, and you can cause a rupture of that extensor tendon that goes all the way to the tip of the finger. Oftentimes there'll be a little bit of a droop at the tip of that finger, and you won't be able to actively extend it. So we'd want to be able to see that finger and see if there's a little bit of a droop, or what we call an extensor lag to that finger. That's something that we would be able to observe, and it's very difficult to test otherwise. Otherwise, besides that, once the telehealth hand and wrist physical examination is done, we'll come up with a plan. It could be as simple as you not needing to come into the office for any further evaluation, maybe just us showing you some home exercises to do, and maybe using some over-the-counter anti-inflammatories and ice and other modalities to help with the condition, to maybe something that could need urgent referral to either an emergency room or an urgent care nearby. Occasionally, if we see a possibility of a fracture or a dislocation within one of the joints of the hand and fingers, we may need to have you come in and get an x-ray and further evaluation. Occasionally, we may need to order nerve conduction studies in the case of a carpal tunnel or a cubital tunnel syndrome where the ulnar nerve is pinched, or maybe advanced imaging like MRI or CT scan if we think there's a ligamentous injury. In any case, before, during, or after the telehealth visit, please be sure to ask any questions or bring forth any concerns that you may have. We're here to help, trying to provide the appropriate orthopedic care here in the Quad Cities during this COVID-19 pandemic. Thank you for your time.